Hello, everybody, and welcome back to Vision and Impact, the podcast where we sit down with the founders and disruptors really transforming the future of health, wellness, and biotech. I'm your host, Sharissa Olivas, and I'm the founder of White Wolf Marketing, where we help visionary health brands grow with clarity and scale with purpose. And today I'm joined by Dr. Joe Pazona, a board-certified urologist and the founder of Pazona Health, which is a direct pay, virtual-first medical practice, really helping men and women take back control of their health. And Dr. Joe is unapologetically honest, radically patient-focused, and really committed to solving the real root causes of issues in the bathroom, the bedroom, and beyond. So today we're talking about why the traditional healthcare system is broken, how hormone and metabolic health are central to performance, and what it really looks like to actually empower patients instead of just pushing pills. And these are all things that we've kind of touched on past episodes, but I'm excited to really get into how we're transforming the healthcare system. So let's get into it. Hi, Joe. Thanks for hopping on today.
Thanks, Sharissa. Appreciate you having me.
Well, let's hop into it. I want to get into a little bit about your story. What really made you leave the traditional urology expertise area and launch a more direct pay and virtual practice?
I think from the moment I finished my training, I was never okay with this idea of just putting bandaids on problems. When as you look at urologic issues, erectile dysfunction, troubles urinating, as we call it, the issues in the bedroom and the bathroom. The root cause comes down to metabolic dysfunction, type 2 diabetes, obesity, all the things we're now hearing more and more about. And so it just never felt right to sit across from that guy who clearly needed Viagra in the moment so he could perform, knowing I wasn't really changing anything. That ultimately I didn't have the tools, either due to lack of knowledge from our traditional sick care of medical education, nor did I have the time nor the incentive to really dive deep with these patients. I'd have 30 patients in my clinic I had to get through. And so, I always felt like a bit of an oddball when I was out in practice, even as a surgeon, but I loved what I did. I didn't know any better and just kind of naively went along my way until I ultimately just felt like I was kind of coasting. And I saw these issues and no one else seemed to want to fix them. And so there were several parts of my journey that led me to where I am today, from leaving a great job in rural Washington state to go be a head of urology at a Southeastern university that ultimately just was a very similar model. And it was just packaged differently, but it was still the same stuff. I was an employee. I was just supposed to see a lot of patients, do a lot of things to them, because that's the way people make money. So back in 2019, I transitioned to Nashville, where I noticed a lot of healthcare tech, a lot of entrepreneurial pursuits going on, and a lot of options for someone in my situation. A lot of the doctors here are still independent. And I said, I don't want to be stuck somewhere where if it doesn't work with this particular hospital, I have to move my family again. Came to Nashville, and then just a small little global pandemic hit in 2020 that kind of changed all of our lives for better or for worse. And it was at that moment I knew I had to go and open my own practice, where just out of pure survival and necessity, I said, I've got to go do this. I've got to take control. And I did so always knowing at some moment we were going to have to go direct payment, direct care, because it's just from an economic perspective, it's a broken model. I don't think people realize that doctors' reimbursement for just caring for patients. So you come in and see me, Sharissa, and I spend however much time that we need to get to the bottom of your issue, that the wages haven't even kept up with inflation. Never mind going up. They've been cut every single year for 30 plus years, but yet our rent goes up. Electronic health records charge me $8,000 a month to not work efficiently or make my life or my patient's life better. I have to pay my team members competitive salaries. So they've all gotten pay raises, but yet the doctor keeps getting squeezed. And we've got to break away from this narrative of the rich doctor who goes and plays golf every weekend. I mean, it's not serving anybody. And I mean, literally got to the point where I would have had to potentially close the doors at Pazona MD if I didn't switch out of this model. It's not that, well, I only have one sports car, I need another. No, I mean, I literally was losing tens of thousands of dollars a month because I refused to compromise on spending time with patients and refused to take anything but a holistic approach. And, call me naive, but I'm not going to compromise my ethics with how I deliver patient care. And we tried to be efficient in many other ways, whether it be leveraging telemedicine, training great nurse practitioners and PAs, using virtual assistants. So we tried other methods to make the economics work while never sacrificing that patient experience. And it finally just got to a point where, again, similar to previous times in my career, we just really didn't have a choice anymore. And so we're about 3+ months into the journey, and so far so good. The right patients are responding, and breaks my heart that I can't care for everyone in this model, but it has removed all the barriers of our broken system and made it so I can now continue to keep the lights on, pay my team members a competitive wage, and have an actual business that we can grow to deeply serve people without having a master in a health insurance company dictating either how much we're paid or how we should deliver that care.
Yeah, and you brought up an interesting point that gets brought up quite a lot in all of our calls, and that is COVID. And I think it really just exposed how fragile and outdated that traditional healthcare system is. And it really forced people to rethink what care looks like. It pushed both the patients and the providers to look for something else, whether that's something more flexible, more accessible, more like human, and even more efficient. So what you guys are doing is a direct response to that shift. It being virtual means it's more accessible, and it's designed for people who want better care, I guess, without all of the fluff, without sitting in a waiting room, without going to like that one room and sitting there with 4 white walls. And so I think COVID really accelerated the need for change. And it seems like it helped fuel your business model.
Yeah, it absolutely did. And I agree with you. I mean, listen, nothing can replace human touch and connection. I hope that is the one part of our humanity AI never figures out, and that we always have that. And you can't replace being in the same room as a patient when you're delivering a cancer diagnosis or responding to nonverbal cues. But there are so many barriers and points of friction to get in front of a doctor that virtual care breaks down, that we've got to really start, I think, putting more resources into. Everyone's talking about, telemedicine is dead. I saw some, LinkedIn posts showing that Teladoc stocks are, in the toilet. They're in the toilet not because telemedicine didn't work. They're in the toilet because they had a bad business model and they went in bed with the insurance companies. They tried to commoditize healthcare. That's why these places are failing. It's not because there's something inherently wrong with telemedicine. If I'm counseling a person on a lab follow-up because we check their testosterone because of fatigue and low energy and putting on weight, I don't need to be in the same room with you anymore to go over those results. But if that expedites how quickly I can get you in, it allows me to care for more people. People are more efficient as well on telemedicine visits. It's very much like just direct and to the point. Let's get this done and over with and move on with our day. Whereas we for decades have just accepted you've got to take off work, find daycare, or find someone to help take care of mom, go park, then go sit in a waiting room for 45 minutes, have Barb up at the counter, yell your name and all your private information out for everybody to hear, fill out all this paperwork, only then to get 2 minutes in the room with a distracted healthcare professional who's just button clicking the whole time. That's not good healthcare. So we have to look at what are best alternative solutions. It would be ideal if every patient can get an empathetic, thoughtful healthcare professional for as long as they need to dive deep and solve all their problems. It's just not reality. Like, let's get over it. It's just not the way it is now. In our model, I can spend as much time as I want with a patient. And in fact, we still do in-person care, but now I don't have the barriers. I could spend an hour with somebody. I've taken a couple patients out on visits and we've gone out for walks around the clinic, gone, hey, it's a beautiful day outside. You mind if we go talk out there? They're like, no, that's great. I mean, we're sitting here preaching wellness and getting in your 10,000 steps, but yet we sit in a chair for an hour with our patient. So, yeah, it's COVID for all that got politicized about it, like any tragic event, like any big disruptive event, opens up opportunity, and it opened up an opportunity for our practice. And I think for people to just start changing the narrative, like we don't have to keep doing healthcare the same way we've always done it.
Yeah, and I think before telehealth was more of a backup plan. It was just something that was there if you couldn't get to the doctor. But now I feel like it's trying to change to be the future of care, which is really exciting because it's giving patients something more. It's giving them access and control and convenience without necessarily sacrificing quality. When you're limited to just the doctors in your area, I mean, if there's only one doctor that you can see, what choices do you have than to sit in a waiting room for an hour? What choice do you have to not go to a doctor who doesn't spend that time with you, that comes in and they have another patient right after you? They're booked three patients at the same time. So I feel like what used to be more of a rushed, fast office visit is hopefully becoming more of a meaningful conversation from even the comfort of your own home or your office at your lunch break.
Yeah, I mean, that's what we're seeing for sure. And you bring up a couple excellent points. The first being telemedicine allows you to see physicians and healthcare professionals who you wouldn't normally get access to. You're right. You are typically stuck with who's in your town, who's in your network. Well, you know, as long as we've got a medical license in the state of where a patient lives, we can deliver care. A lot of patients travel to come see us, and we can do their follow up remotely. And then you're exactly right that we've got to stop this narrative. And I see it from too many of my colleagues. Quality of telemedicine is bad. No, it isn't. If it's bad, that means you're bad. If the care you're delivering is bad. Patients, if the alternative is as a patient, I'm just not going to come see you, versus let's just have a conversation and let me be a guide. I don't need to touch my patients on every single visit. It's a quaint idea to think that the old school, GP could do the 30-minute physical exam and diagnose all these conditions. We live in an era of advanced diagnostics. We live in an era where we have a supply demand issue, and there's too many patients who need our help. And there's not enough empathetic, well-trained physicians who've got availability to care for them. And if this breaks down those barriers to get those patients care, then I'm all in favor of it. We can't just put these blanket statements that telemedicine is bad. It is a tool. The quality of the care is up to you.
And I think we're living through that transformation right now. The technology is a driving force, and technology being AI powered diagnostics to even like remote monitoring. And so we're seeing a lot of platforms like yours that are direct to consumer. And we're really shifting away from that like old hospital based model, which I like to see as something that's more personalized and predictive and accessible. Because before it was you're like required to wait in a waiting room. Maybe you had to have a referral. You had to wait for paperwork to be transferred. And now that all happens through your phone and hopefully with more clarity and control than ever before, everything being in one place. And I think that you can provide quality medical expertise with the right technology and the right doctors. I think it really can redefine the entire patient experience.
Well, it has to, because the experience in the traditional model is awful. I mean, it's just no one likes going to the doctor. And so in our office, we welcome people with a coffee or a healthy snack. We sit down with them. We offer both remote and in-person visits, whatever works best for you. We do in-house phlebotomy to do our lab draws right there. You call us today and we'll work you in for an appointment tomorrow. We've got to change the paradigm that there's just this cookie cutter way of doing healthcare. And our team at Pazona MD obsesses over the patient experience. We map out from the first phone call to a year later, we've got a raving fan of a patient. What do we have to deliver to make that an incredible experience? What are the things that we can do? This doesn't have to be all gloom and doom and, 70s furniture and gray, ugly walls and unhappy staff. I mean, it can be a Disney or Chick-fil-A sort of experience. And I think those are the models we should be looking at. It shouldn't be the traditional hospital-based model that you alluded to.
Yeah. And one thing that I want to get into is that most people don't think of urology or every year like health checkups as a telehealth specialty. And so how are you making that virtual care not only work, but I guess feel better for people?
Yeah, I mean, to be clear, I would say most of our initial visits are going to be in person with
Hmm.
patients, whether they're coming in to have a vasectomy with us, they're coming in for a wellness evaluation, a hormone check. And we look at telehealth again as a tool. It is a way to cut down the barrier for the appropriate sort of follow ups. But again, I think it just goes back to thinking about that whole patient experience. What are the moments we can really make a difference and make this something that is seamless? What are ways that we can make sure that we don't practice cookie cutter medicine, but we do follow clinical care pathways to ensure that we are checking labs on a regular basis, that we are screening for certain diseases and processes. And I think we take the approach that although I'm trained as a urologist, I'm first and foremost a physician. And medicine has gotten so siloed. The poor internists and family practice docs, the GPs, essentially have turned into glorified triage providers. There's so much they have to do. There's so much they have to know in so little time. It's all you have time for. All right, you got back pain, you're going to the orthopedist. You got diabetes, go see the endocrinologist. You have trouble with your prostate, go see the urologist. And anything else? Okay, great. I'll see you next year. And that's not their fault. It's the system that has created that. And instead I say, what is the root cause, like I alluded to, of most urologic illnesses? Well, it's hypertension, type 2 diabetes, obesity, smoking. If I'm not addressing those things with my patients, if I'm not talking to them about what food they're putting in their body, whether or not they're exercising, whether or not they're getting 8 hours of quality sleep and have a good sleep routine, and whether or not they're managing their stress levels, I'm really not helping them. I'm just putting a Band-Aid on them in this sick care systems. This isn't anything I've come up with. You've got, I think, some just really thought leaders like a Dr. Peter Attia, who is just preaching from his bullhorn about medicine 3.0, this idea of let's create health. And that is the best way to prevent illness. That we shouldn't just sit around idly and go, okay, you're pre-diabetic. Well, you're not ready yet for insulin or metformin. You should lose some weight. I'll see you next year. And then that's all we do for the patients. And then we're surprised when a year later they come back and they're diabetic and their A1C levels through the roof. So we've got a great opportunity. And I think as a urologist, we are well positioned for this because, again, when people have trouble in the bedroom and the bathroom, they're going to seek medical help. Those are two pretty important things, not only for guys, but for women as well. And so I think we have just a really neat opportunity with our team and other urologists to really take this on and look at it from a different lens.
Yeah. And something that we often bring up on this podcast is preventative care is better than sick care, right? So the traditional healthcare system is built around that sick care. You wait until something breaks and then you try to fix it. But the real health isn't necessarily reactive. It should be preventative. And it's about taking care of your body, your hormones and your metabolism, your sleep, your everything before you actually hit that point of no return. And that means paying attention to those things that you were talking about, those lifestyle choices, your diet, your sleep, your stress levels, and the movement that you have in your life, and things that don't necessarily show up on a prescription pad, but that directly impact your long-term health. And so you got to help patients figure out that wellness foundation so they don't end up trapped in that system that, in my opinion, is a little bit designed to keep them sick. I think our healthcare system is very messed up at the moment.
I'm not a conspiracy theorist, but I agree with you 100%. I'll take it even a step further. Yes, we should be preventing the illness, but once the illness sets in, the true therapeutic approach has to be lifestyle based. I mean, let's just take type 2 diabetes as an example. The root cause of it is you've put too much into your body. Your body says, hey, bud, there's no more room for all this energy you're stuffing in. The liver's fatty, our glycogen stores are full. I'm just going to turn this into fat. And ultimately, when the pancreas has to keep producing more and more insulin and the cells are going, quiet pancreas, we don't want to listen to you, you develop insulin resistance. And so what do we do with those people? We put them on something to shove more of the sugar into their body in the form of insulin. The example someone else has used is, it's like you got a suitcase full of clothes and you're just trying to stuff more clothes in the suitcase instead of saying, maybe we should take some of the clothes out. And we can do that by, I don't know, time restricted eating, not eating as much of processed foods, moving our body. So even the therapy for these diseases is being completely mishandled. I mean, and type 2 diabetes is one of the fastest rising diseases and is probably the root cause of the top 4 killers of US adults. So, but what do? We just listen to big pharma when we see a bunch of dancing, out of shape people on TV smiling that they got their Ozempic or whatever other medication. And no one's addressing the fact that there's actual inexpensive ways to fix this, because that wouldn't serve anybody. And again, we prescribe GLP-1s like semaglutide and tirzepatide. There's a time and a place for them. Like telemedicine, they're a tool, but it's not getting to the root cause of why the disease developed. And so, yes, we've got to break through that system. And to me, the only way to do it is to break free of insurance, because insurance is all about take a bunch of symptoms, package them up in some ICD-10 code, then turn that into some 99203 or 204 billing code, send it off, and hope you get paid in 60 days for just pushing pills on patients. And it's just wrong. It's just until more physicians realize that they have the power to step out of that system and do it differently, we're not gonna change it, because there's too many people making way too much money on illness right now.
Yeah, yeah, and most of the time, it's not necessarily the medicine that's broken. It's the insurance model. It's the time limits that doctors have and the restricts on treatment options. And I feel like it really puts paperwork above patients all the time. And their providers are just forced to make decisions based off, like you said, billing codes versus not what's actually best for someone. And so when you remove that insurance barrier, I feel like that makes room and space for real conversations and figuring out that root cause care and actually healing, not just putting a Band-Aid over it and, hoping that it fixes it. It's getting to that root problem, because masking symptoms doesn't heal anything.
Yeah, I have a lot of empathy for my colleagues who are still in the system. They have these golden handcuffs. They feel like they, quote, can't do it if they go out on their own. It'll, never work. We've got this fixed mindset and very risk averse as physicians. And so you're stuck in the system. And then I'll go an even step further. We don't learn any of this in our training. Like, the number of nutrition classes I had in medical school was laughable. If you look at even the latest nutritional guidelines that have been sent out by the US government, they are comical. I mean, but again, I'm not surprised. Why? Because the food lobby and big pharma are very, very powerful entities, but they get it completely wrong with how we should be thinking about macronutrients. I mean, the fact that we call ultra processed foods even food is laughable. The fact that we have a limit the fact that we don't set an upper limit of sugar, processed sugar, of 0, because that's really what we should be consuming, is laughable. And we don't learn this. And so I've had to spend the past, honestly, decade learning a lot of this from people like Peter Attia and Andrew Huberman and all the other sort of wellness gurus out there who are backed by really good science. It's not, we're beyond the bro science of, the jacked guy in the gym who's putting everybody on testosterone. There's data that's out there, but you ask any physician and we don't know it because we didn't learn it in school, and we don't have time for it now because we got to see a patient every 15 minutes. Because if we don't hit that, we won't hit our RVU goal. And then, we're going to be replaced by a less expensive widget. And so I have a lot of empathy, but I hope that more of my colleagues will take my lead and step out and realize that it can be done. Patients want it, and it's the right way to truly serve people. And it's my goal to help be part of an alternative ecosystem that removes all of the greedy fat fingers making money off illness and instead keep the money and the care between the doctor and the patient. What a novel idea. That's the most important relationship in healthcare, but yet it's marginalized by everything in our country. And so, I'm trying to do my part here with it, and believe strongly it's is the path towards wellness, and we're going to have to do it because not only is the system broken, it's only getting worse.
Yeah. And I always say, if a doctor isn't asking about your sleep, your lifestyle, your nutrition, your stress levels, they're not practicing medicine. They're a legal drug dealer. And I saw that and my mind was just completely blown because if all you're doing is writing prescriptions and not addressing lifestyle, then that's not healthcare. That's putting a band-aid on something, and that's symptom management. I feel like true care is looking at the whole person, not just lab results, but like understanding how your hormones work and your gut health and your metabolism and how your nervous system all works together. Instead of chasing symptoms, let's ask why things are happening. Let's definitely still do the data and the labs and all the science, but let's give patients a clear, I guess, roadmap to not just, feel better, but to truly be better down at the core and function at the best that they can.
Yeah, I mean, that's the way it should be. But again, the issue is the system doesn't incentivize it, and we don't even learn it in our training. So, I mean, that's the sad part, Sharissa, is that I agree that's the way it should be done. And there certainly are physicians who've gone out and done that. And, on the flip side too, there's also people who have gone that far and are, glorified snake oil salesmen. So, their drug of choice now is some supplement that's never been shown to help anybody, but they're hawking it because it makes them money now. So, we got to be careful that we don't go too far toward that end, but I do feel there is a responsible middle ground where we take an approach that you're advocating of dealing with the root cause of these issues, which are 80-90% lifestyle, sprinkle in some of the functional medicine and the micronutrients and the gut health, while also still honoring the traditional healthcare system and understanding diseases and when there is an appropriate use of medications. So anytime I hear someone who says it's all this or all that, I just kind of tune them out because they have there's likely some bias or fixed mindset that they have. The more someone's an expert, the more they say, I don't know. It depends. That's when you're with the right person, someone who really takes the time to think about it, someone who's also willing to change their mind. It's taken a long time for me through 17 years of my practice to get to where I am today. And I'm sure a lot of the things I'm saying now are going to change, and that's okay. You want to really do your diligence, but hold on to these ideas, very loosely, because it's all just one really good study away from going up. That's not good for you, or that's going to extend your life 10 years, and so you got to be willing to change your mind and be open. So that's, I think, my biggest piece of advice.
And so there's so much information out there. Like you said, there's that snake oil, there's everything. And it becomes overwhelming. And I think that's why people stray away from it, because it's not regulated. So what should people really understand about their hormones, their metabolic health, and overall lifestyle? Like, what does that mean?
I think what people just need to understand is that 80 to 90% of the illnesses you are going to develop in your life are due to your lifestyle. And if we look at the different pillars of lifestyle, it's the things you just mentioned: the food that you put in your body, how much you move, the quality of your sleep, how you manage your stress, and how you optimize and balance your hormones. Those 5 things all play a role, along with environmental toxins, whether it be cigarette smoking or the plastics, the microplastics in our water bottles. They all play a role in our health. And you're right, it is so complex. And so I think the biggest piece of advice is to partner with the right healthcare team to really dive into that. And, how do you identify someone? Well, again, take a look at what their motivation is. If they're pushing, if they've got a giant supplement store, they're probably going to push some supplements on you, and that, we've got to get out of this idea that some things are more natural than others. I mean, let's take a look at, the weight loss medications. They are basic analogs or mimics of a naturally occurring hormone in our gut called GLP-1s. So is that any less natural than the oregano oil you get at Walmart? I don't know. I look at it less about natural versus not natural. And we're putting a various number of molecules and compounds in our body on a regular basis. And we've got to put the right compounds in our body to expect good results. And then we need to care for our body in a way for it to behave and to perform optimally. And that means having the right hormone levels. That means moving your body, sleeping, and so on. So I think you've got to partner with the right healthcare team first and foremost, and realize that if any one of the pillars is off, it is going to impact your health. So if you are diving down the rabbit hole of you think your lead levels are high and you've got lead toxicity, but yet you've got a belly, you don't work out hard, and you don't eat good whole foods, you're probably walking over the dollar bill to pick up the penny. If you are doing everything right and not making gains, and you go and get your hormone levels checked and they're really low and out of balance, and you refuse to balance them, you're not going to perform as well. I don't care what you do. If your hormones are not balanced and optimized, you're going to have a hard time being healthy. And that includes sleeping and managing your stress level. And so it requires a combination of all these things. And the way I approach it and our team approaches it is we try to look at big principles. What are some things that are unlikely going to change over time? So for instance, eating whole foods. If anything's got more than one word in the ingredient list, maybe you shouldn't eat it. You need to sleep 8 hours a night and have a good bedtime routine. You have to move your body both through resistance training and walking probably 10,000 steps a day. All of those things are non-negotiable. If you're not willing to do those, then you're just not willing to get healthy. And then there's other things that change over time. And, some people might benefit from intermittent fasting. Some people really need some supplemental testosterone or estrogen. Some people need a little semaglutide or tirzepatide to kickstart their weight loss, to get some easy wins and get some good momentum. So we try and personalize it, but stick with big picture principles that really make a difference and that we can all agree on, because there's so much, there's too many zealots when it comes to the fitness, right? Whether you're the supplement guy, the protein guy, the vegan versus the carnivore. I mean, it's like it could drive you bananas and you go down these rabbit holes. And then I think the last thing I'll say is we've got to look at best alternative solutions again. I brought that concept up earlier. If you go online right now and you follow everything you're supposed to do by these health gurus, you're going to have to quit your job to get it all done. I mean, seriously, I'm pretty obsessive about my health. I have a spreadsheet that makes sure that I hit my macros. Did I walk 10,000 steps? Did I get my 150 minutes of zone 2 cardio this week? Did I do a VO2 max workout? Did I lift weights 3 days? Meal prep, it's exhausting. And so, I've got the luxury of creating a bit of a remote schedule. My kids are a little bit older and have some more me time compared to a younger parent with toddlers. You can't just lay all this stuff out there and think the average person's going to take it and implement it. And so we really try and find easy wins and compromises and work with people to go, all right, you're a dad, you've got 3 kids, the oldest is 6. I know there's no way I'm going to get you to sit and make 3 meals a day, but let's talk about your breakfast and what's an easy win we can get, and let's start with that. And then let that compound. It is really, it's fascinating. We're at a time where there's all this information, and I think it's going to be interesting to see how long some people can live who do spend all their waking hours on longevity and wellness. But for the average person, it's also overwhelming. And again, this is where it's so important to partner with the right healthcare team to guide you through it, because there's ideal and then there's practical. And practical will beat ideal 7 days a week. What can we get you consistently doing, even if it's not perfect, that's better than what you're doing now? And I think that's the way you've got to approach all of this.
Yeah, consistency is key. What are lifestyle changes that you can make that are going to last?
Yep, absolutely.
And so last question, What advice would you have for somebody that knows something is off? Maybe they're not sleeping well, or maybe they don't have the right energy. How would they start advocating for themselves in this crazy, confusing system?
Yeah, I think you've got to go find the right healthcare team to partner with. And if you want to start with looking at us at Pazona MD, we'd be happy to help out. And if we can't for whatever reason, because you live too far away or we're not licensed in your state, we'll help you find somebody. You've got to partner up with the right person. And the sad fact of the matter is, one of the reasons I'm doing what I'm doing is purely selfishly. I know that if I go to most of my colleagues, they're going to look at me and just go, "You're fine." Well, I don't want to be fine. I want to be optimal. I want to be robust. I want to be there for my grandkids and as active as can be. I want to have a long health span. And if you can't help me answer those questions, then you're probably not the right fit for me. And so I've selfishly created our practice and pivoted it for people like me who feel like they're lost in the system. So I think you got to find the right person. I think a real basic actionable thing is, especially if you're over the age of 30, go get your hormones checked. I mean, that's an easy win. A lot of times you'd be surprised men and women are having hormone imbalances. And so that would be testosterone in men and testosterone and estrogen in women, even premenopausal, can be out of balance and not optimized. And so get that along with other hormonal panels, micronutrients, and find the right healthcare partner to start addressing this. Because I'm not the only one who's out there. Pazona MD is not the only medical practice out there. There are people who are my colleagues who really buy into this. And just politely say no thanks to the traditional system and the traditional doctor who's just looking to treat illness with another pill.
Awesome. And for anybody that's listening, where can they learn more or connect with Pazona Health?
Yeah, so if you just go to Pazona MD, Pazona MD as in medicaldoctor.com. You could also, if you're a healthcare professional or want to look me up on LinkedIn, you could just type in Joseph Pazona, and I could share with you, Sharissa, any of the links as well to put in the notes with people. But we'd be honored if you chose to partner with us on your healthcare journey. And if not, we could certainly steer you in the right direction.
Well, thank you, Joe, for hopping on and going through all of that with us. It was such a pleasure to have you.
No, this was great, Sharissa. I really appreciate the opportunity, and hopefully people left with some actionable items here and some hope that there are physicians out there who are looking to improve this system and create an alternative ecosystem focused on health instead of sickness.
Yes, completely agree. That is a wrap on this episode of Vision and Impact. Huge thank you to Dr. Joe for cutting through the noise and sharing a very real and no BS perspective on what this modern health really should look like. And if you're tired of that 7-minute doctor visit and that one size fits all medicine, check out Pazona Health and learn how to get the care that actually puts you, the patient, at the center. This was a great conversation and something I was really looking forward to getting into. So thank you for listening. And if you're a health or medical founder looking to scale your brand or amplify your impact, connect with me at White Wolf Marketing. Until then, stay sharp, stay visionary, and keep building something that matters.